At Uganda's capital Kampala, Mulago Hospital's long tradition of excellence in tropical medicine has made it a focal point for AIDS research programs. Here, as in all African countries, HIV tests are too expensive for general use. AIDS is diagnosed through guidelines laid down by the World Health Organization, known as the Bangui Clinical Case Definition. To qualify for AIDS, someone must have a combination of symptoms, like persistent diarrhea and fever for a month and a dry cough. The trouble is that many of these symptoms are indistinguishable from those of old established diseases like TB and malaria. The Ugandan Ministry of Health did not allow us access to film patients inside their hospitals. They were concerned about patient privacy and the projection of too many negative images in the West. But we were able to speak freely to the doctors. At Old Mulago Hospital, Dr. Martin Okot-Nwang is in charge of the TB wards. He's concerned about the way African statistics are being wrongly reported. TB is a disease that occurs where there's poverty, malnutrition and lack of medicines, conditions all rife in today's Uganda. Figures have doubled recently in these wards.
We have just recently undergone through a series of wars in this country, and this has led to a breakdown in our health services. It's not unknown that following wars or famines, increases do occur, particularly in infectious diseases or communicable diseases, of which TB is one of them.
The rise in TB cases in Africa has led some scientists to speculate that the HIV virus is making some people more susceptible to the disease. But it's hard to find any evidence for this. What is documented is that flaws in the clinical case definition, that is the combination of symptoms used for diagnosing AIDS without an HIV test, have meant that many TB cases have mistakenly been called AIDS.
A patient who has TB and is HIV positive could appear exactly the same as a patient who has TB and is HIV negative. Clinically, both patients could present with prolonged fever. Both patients present with a loss of weight, marked loss of weight actually. Both patients would present with prolonged cough, and in both cases the cough could equally be productive. Now therefore clinically I cannot differentiate the two. Even when I look at the blood, I may find some similarities still between the two groups.
In the past, TB of the lung or pulmonary TB was not considered a disease that qualified as AIDS by the US Centers for Disease Control, but it was added to their list in January this year.
I think if they could include pulmonary tuberculosis as AIDS-defining case, then all the TBs in Africa will, almost all the TBs in Africa will be AIDS.
The danger in calling all TB cases AIDS means that money badly needed for the treatment and cure of TB is being diverted into preventing the spread of HIV.
What keeps a man energetic and keeps him doing what he does is the hope for the future. But once you tell me that I am HIV positive, then you have given me this message that you are going to die, and therefore I have no energy for the future.